I'm Dr. Jeffrey Popp, cosmetic surgeon here in Omaha, Nebraska. Been doing this for over 20 years. We are going to talk about otoplasty, AKA ear pinning, people with prominent ears. So I'm going to start with a little description of the procedure and how it applies. The easiest way to look at ears or prominent ears is two things, and they all basically have to do with the cartilage in the ear. Really nothing about prominent ears has to do with the skin. It's all the cartilage skeleton, which creates the form of the ear. And we all know that cartilage is rigid yet bendable. So there are three possibilities that people can have in terms of having a prominent ear. One is the cartilage that forms this cup in here, or bowl, can be overgrown, or we call it conchal. The bowl is called the conchal bowl, and that bowl can be hypertrophied or overgrown, which means the entire ear will come away from the side of the head. So that's problem one, called conchal cartilage bowl hypertrophy. The other has to do with the top of the ear. This is the helix, and this little crease or furrow right here is called the antihelical fold. And in some people, that fold doesn't exist. So what happens is the top of the ear comes out. So that's the second problem, is loss of the antihelical fold. So if you put those two problems together, you can have one problem, the other problem, or both problems. And I would say the vast majority of people I see, they almost all have conchal bowl hypertrophy, so the ear is pushed out, and some have, to a varying degree, a loss of the antihelical fold. So the basic crux of otoplasty is to reduce the overgrowth or the hypertrophy of that cartilage to set the ear back closer to the head, and if need be, recreate that antihelical fold so the tip of the ear is folded inward and not out. This particular problem, we'll just call it prominent ears, there is no non-surgical alternative. We had talked at another time about neck liposuction. I'll interject that here because there are non-surgical options for that, but there are no non-surgical options for prominent ears. It's either surgery or nothing. So a good question at the beginning of anybody's adventure in terms of fixing or potentially fixing prominent ears has to do with cost. And in this part of the country, in the Midwest, you're looking probably between $4,000 and $8,000. That would be the range. The difference can in part be due to how the particular surgeon divides that up. Because in the surgery, in this particular surgery, in all surgeries, you have to pay the surgeon, you have to pay the surgery center, you have to pay anesthesia, maybe nurses, lab, various things like that. And we also throw the office visits after surgery in there. So when we quote a price, it's for everything. It includes my fee for both ears. Since you have two ears, sometimes people be a little tricky and they'll say, well, the cost is only like $1,500, but that's just for one ear and that's just for that doctor's fee. So, it's like a lot of things when you go out to buy stuff, sometimes you see the number, but that's not everything. I'm amazed at how many things are now added on. I think cars are a good example where, you think, well, but you have to pay extra for this package and extra for that package. And pretty soon the $35,000 car is now $40,000 or more. And so, you can do that with this, but in this practice, in my practice, the fee includes everything. That's it to the penny. So in the Midwest, about $4,000 to $8,000. That includes everything. And then if you go to both ears, my fee for both ears, anesthesia, nurses, equipment, surgery center charges, all your visits for as long as we need to see you. Obviously, if you go to either coast where life is more expensive, you're going to pay a lot more. A question that also ties into the finances or the cost of this surgery is whether or not this is covered by anybody's health insurance. And to date, we've not seen it covered by any health insurance. We look at these things as I would say prominent ears is one that could potentially be covered by insurance, but they choose not to. So when we talk about what is cosmetic and what is not cosmetic surgery, cosmetic is done to basically take a normal situation and improve upon it, enhance it, alter it. Non-cosmetic surgery, or what we call reconstructive or functional surgery, that's to take something that is abnormal due to disease, maybe an accident, cancer, birth defect, something like that. So you say, okay, let's apply that to a child who's born with big, ears. Well, 90% of kids or more that are born don't have those ears. So technically that's a birth defect. But if you don't fix those prominent ears, it's not a detriment to your health long term. It doesn't cause cancer, heart attacks, strokes, doesn't shorten your life. But there's a huge potential psychological toll. This world of social media is pretty harsh. It always has been, even before social media, and kids with big ears or funny looking nose can be horribly ridiculed. And psychologically, it can be very damaging. So, in a perfect world, I think that prominent ears probably should be covered by insurance, but it's not. And the trend has been for surgeries that sort of sit on the fence like this to be not covered as we go forward in time. There used to be, just as an example, tummy tucks. People had huge rolls of skin and fat. Those used to be kind of universally covered by insurance, but now they're not. There are some exceptions, but I think insurance companies basically look at what can we eliminate without causing damage. In other words, you couldn't really say if a person is if their coronary arteries are plugged, we're going to deny you having a stent put in or a coronary artery bypass surgery because you'll die. Well, then you'll sue us. But if you have this fold of skin, of course, you're probably obese, so you've got a little risk factor there, obesity. But if we don't fix that skin for you, you're probably not going to die of a heart attack or a stroke or have something bad happen to you just because you have that excess skin. So they're always looking for things to not pay for. Always. That is the MO of every insurance company today, sadly. So circling back to otoplasty, to the prominent ear issue, you just don't find insurance companies that are going to pay for it. Most of these are done in kids, so a health savings account probably wouldn't necessarily apply unless they can get their parents to switch it over, but that would be the only other financial option, is if a family, mother or father's business had access to a health savings account. This would be one where I'd say I think they should pay for it if it's available. If insurance won't, I think that at least should. So, otoplasty is considered to be permanent. When you remove that prominent cartilage, the hypertrophied conchal cartilage, that never comes back. The way we create this anahelical fold that I referred to earlier is actually with permanent stitches. So there is a slight possibility that if you had that done, and let's say, you were playing soccer or basketball and you get hit in the head hard enough, you could break those stitches and that might have to be redone. That's very rare, but that would be the only thing that would need to be revised in the future. Otherwise, we consider basically any type of otoplasty to be permanent forever.